Hi, I'm Dr. Wendy Cornett. I'm a breast and endocrine surgeon with Prisma Health, and I have been a breast and endocrine surgeon for many years. I've been with this institution for over a decade. I'm from Cincinnati, Ohio, and I went to medical school there. My residency I did here in Greenville, and then I did fellowships at the University of Sydney, Australia, in endocrine surgery, and at the American College of Surgeons Oncology Group at Duke University for surgical oncology. I then was at Medical University of South Carolina before I came here to this hospital system. Breast and endocrine surgery is really a subdivision of general surgery or surgical oncology. So breast surgery obviously takes care of breast ailments, whether they're benign problems like benign lumps or infections, or cancer. And then endocrine surgery takes care of thyroid and parathyroid problems, and those are glands located in the neck that help control things about metabolism and calcium and bone density. When I was in training, I was doing general surgery with a plan to do all general surgery. But what I found was that a lot of women wanted to see a female surgeon. Many of the endocrine problems that we see requiring thyroid or parathyroid surgery occur in women, and most breast problems also occur in women, although they can occur in men. I found myself taking care of a lot of these problems, and that's where I focused my specialty fellowships. So teaching a patient about their disease process is really an integral part of what we do in taking care of a patient. So if someone has a problem with the breast, or specifically breast cancer, they'll need to know what their options are, and so they really need to understand the subtle differences in their choices versus someone else's choices. There are a lot of different ways that breast cancer and other breast issues can be treated, and what's best for one person may not be best for another. So one of the things that doctors have to do, I think, for almost any disease process is to make sure that the patient understands how their personal medical condition can be best treated and how that affects them. By the same token, for endocrine problems, a lot of people confuse the way the thyroid works, its function, with the way it looks or its structure. And those things are completely separate. So people will see me thinking that they have a problem with how their thyroid works when really it's working just fine. And so I think helping to teach the patient helps them understand what their best treatment option will be. And a patient is a whole lot more likely to carry out their treatment if they understand it well. And then as far as breast cancer goes, there are a lot of risk factors for breast cancer, most of which we can't control, but some of them can be controlled. Things like vitamin D deficiency, obesity, inactivity, and so having a plant-based diet and being active and making sure you get enough vitamin D are things that you can do to help prevent lots of illnesses, and in particular breast cancer. So when I'm not at work, I'm usually with my husband, 2 children, and 2 dogs. And we are currently raising honeybees, so we'll see how that goes. But really, my kids take up most of my time outside the hospital. To schedule an appointment with me, please use the contact information on my profile page.